For the second half of this session, we'll talk about environmental sustainability in healthcare. Our first speaker is Dr. Cassandra Thiel. I wanted to give you a little bit of an introduction though, and give you a focus as it pertains to emergency care. We'll start with healthcare's climate footprint. This report came out not too long ago through Healthcare Without Harm, and it essentially demonstrated healthcare's climate footprint is equivalent to 4.4% of global net emissions. Various countries have different impacts and different components and contributions, but regardless, it demonstrated the significant amount of emissions that we create in providing care to patients. A recent article by Dr. Salas and colleagues demonstrated healthcare activities that contribute to these emissions. They define them as having scope 1, scope 2, or scope 3 emissions. Scope 3 emissions are the greatest proportion. You can see there everything from pharmaceutical products, electronics, waste treatment, manufacturing, plastics, electricity, fuel, travel, capital goods, investments. And so now I am excited to introduce Professor Cassandra Thiel. She is an expert when it comes to researching medical systems, hospital design, and healthcare practice. She is an assistant professor at the New York University in the Grossman School of Medicine, the Wagner School of Public Service, and the Tandon School of Engineering. Her research utilizes life cycle assessment and principles of industrial ecology to analyze and improve the environmental performance of medical systems, hospital design, healthcare practice, and medical technologies. As a 2014 to 2015 Fulbright Nehru Academic and Professional Excellence Fellow, Dr. Thiel calculated the environmental footprint of cataract surgery at the Aravind Eye Care System in southern India, finding that Aravind's carbon footprint for pharmacoemulsification was 5% of the same surgery done in the United Kingdom. She received her PhD from the University of Pittsburgh and Bachelor of Science from Michigan Technological University, both in civil engineering. Her graduate training was supported by the Mascaro Center for Sustainable Innovation and a National Science Foundation Integrative Graduate Education and Research Traineeship. She has her own lab and she partners with healthcare professionals like ourselves. I will share just a few of her publications. Dr. Jody Sherman is an anesthesiologist at Yale University, and they frequently publish on reducing pollution from healthcare industry. They came out with the Green Print, Advancement of Environmental Sustainability in Healthcare, and it is a review of just that. It's a real treat to be able to have her share her expertise with us. And although it talks about surgical care, ophthalmology, I want you to think about some of the impacts as it pertains to emergency care. I'll give you just one example before we begin. Dr. Sherman did a life cycle assessment and costing methods for device procurement, comparing reusable and single-use laryngoscopes. They, as engineers and scientists, come up with essentially cradle to grave analysis of these devices. They look at them and what it takes to not only mechanically produce these devices, but use them, get them to the facility, and finally look at disposal. As you can see from this chart, it's really complex, and there's multiple facets that go into determining a life cycle assessment for a product. Now, the authors of this paper, which we will share with you, looked at just laryngoscope blades and handles. Now, SU is for single use. So essentially, they compared single use to reusable handles and blades. On the y-axis, you can see life cycle greenhouse gas emissions per use. They calculated the carbon dioxide equivalents for different devices in a single academic center. And here's what they found. They found the single-use disposable plastic handle generated an estimated 16 to 18 times more life cycle carbon dioxide equivalents than the traditional low-level disinfection of the reusable steel handle. Really big difference. They also calculated the cost, and as you can see here, the single-use cost far more than the reusable devices that were either low-level disinfection, high-level disinfection, or sterilization. Now with that, I think you have a really good basic understanding and can think about different devices we use in our care facilities when Professor Thiel talks about cataract surgery. We can compare her work in the operating theater with our acute care settings as well. Dr. Thiel is a paid consultant with Stryker, which is unrelated to this talk. We would like to thank the Medical Society Consortium on Climate and Health for their partnership and collaboration for this webinar. You can learn more about their work and efforts online at medicalsocietiesclimatehealth.org.
I wanted to give you a moment to just think about what the word sustainability means. At its core, it's just the ability to be sustained. But of course, when we're talking about it in this context, it's more than just, a program that can keep going. Usually the way that we think about it, at least academically, is kind of this triple bottom line concept, which could also be called the 3 Ps or the 3 Es, so people, profit, planet. The economic side of this, the profit or the cost side, is something that we're all really familiar with, right? If it goes bankrupt, it's not sustainable. But for something to be truly sustainable, it has to be sustainable in all 3 of these realms. So on the people side, that can mean the equity aspects. For healthcare, it could be quality or access issues. Basically, it has to be good for employees, for patients, kind of fulfilling. It's a little bit harder to measure things in that realm, but that is truly important. And then the third pillar is this environmental side, or the planetary side. And basically, a lot of human systems right now are consuming more than the planet can actually provide us in our short timescales. And so this is one realm that we're really trying to work on, particularly in healthcare. And my lab, my research is really focused on this environmental side. There are tools and technologies we have available to be able to measure the environmental impact. The major one is what we call life cycle assessment. I'm not going to go into too much detail, but basically this is a tool to quantify the environmental emissions from a product or process throughout that product's life cycle. So you can think about a life cycle of a product. You start out with raw material extraction. You need these raw ingredients. So we take those from the earth, we ship them to a manufacturing facility, probably multiple manufacturing facilities around the world, and we produce products out of those things. We ship them again to the places where they'll be used. In our case, it's usually a hospital, right? We're looking at healthcare services. There may be some reuse that is conducted. So we might sterilize items, we might just straight up reuse them, but ultimately it'll end up being disposed. For healthcare, that's usually a landfill or incinerator. And what you'll notice about our product life cycles, human-made product life cycles, is they're not very cyclical. And this is one of the major challenges with human-made systems, is that we're very linear, which is not natural, right? If you think about things in nature, there's never a true waste product, right? Something will always use the waste from something else. But that's not the case with a lot of human-made things. But life cycle assessment allows us to look at this whole life cycle and then see the inputs and the outputs to the system. So we need energy, electricity, fuel, kind of at all of these different stages, and those emit different environmental pollutants. And so life cycle assessment takes all those different environmental pollutants from across that whole life cycle and summarizes them into a single number, like a carbon footprint. And the reason we use life cycle assessment, one, is because it's a very powerful quantification tool. It gives us solid numbers. So we can compare different products and say mine is greener, and it's actually greener because I have numbers to support it, right? It prevents that greenwashing that's very common in the sustainability industry. We see a lot in food products or common household products. The other thing that's really helpful is it allows you to identify parts of your system that may be underperforming environmentally. So it could be, this transportation method I've chosen has a really high carbon footprint, and there are alternatives that I can substitute that with to reduce my footprint. So we're using life cycle assessment a lot to try to figure out, what part of this system has high emissions and how can we do something about it. So to think a little bit more about healthcare and sustainability, it's unfortunately a field that's emerging, right? We haven't spent a lot of time thinking about healthcare services in terms of sustainability like we have in other industries. But we know that climate is impacting health and our ability to provide healthcare. This is an image from my home institution, NYU Langone Health, during Hurricane Sandy. So we had to shut down in the middle of the hurricane. We lost our backup generators, we lost all power, and a hospital without power not only does not have lights or elevators, it doesn't have ventilation. We don't have life support systems in place, right? This is a tragedy. And unfortunately, we're not the only health system dealing with these kinds of issues. The Camp Fires closed, I believe, 3 hospitals, and the fires now out west have also shut down a variety of hospitals and healthcare facilities. And these are all things that will get worse with climate change. So storms and fires, medical facilities are starting to become aware of this particular issue. It's not just our ability to provide care on the whole, we also have to look at our supply chain. So this is a little news clip from Hurricane Maria, which hit Puerto Rico a few years ago and really shut down a lot of manufacturing of medical products. So we had supply shortages, which impacted our ability to provide care as well. And this will also become more common. We could talk about the COVID pandemic and its effect on PPE supply chains. There are some environmental relationships with the COVID pandemic, but we know that our supply chains are fairly vulnerable right now, and we're just not prepared to deal with a lot of these challenges. Beyond that, healthcare itself actually does have a footprint. So we're not alone in being impacted by climate change, we impact climate. And if we're thinking about that triple bottom line, we impact all 3 of these things, right? So the larger statistics are that US healthcare generates about 10% of the US's total greenhouse gas emissions. That is a very large number. Basically, if US healthcare were itself a country, if we pulled it out and made it its own country, it'd be the 13th largest emitter in the world. We consume a lot of supplies, a lot of resources, energy, all kinds of things, and all of that has a carbon footprint that affects our planet. And unfortunately, healthcare has a really large footprint. And these can also be tracked back to public health impacts then. You can see other healthcare sectors are not immune to this as well. I think the global average is about 4.5% of global emissions are coming from global healthcare services. And so the US is disproportionately high, which is not surprising if you think about our spending on healthcare here relative to other countries. So those emissions end up impacting human health as well. This is a nice big table, but the main takeaway, if you go down this impact category list on the left, there's a category called PM, that's particulate matter. The very top one is global warming, just to give you some perspective there. But you can see for particulate matter, if you go all the way over to the right, the percent of national, where almost 9% of particulate pollutants are coming from the healthcare industry across total particulate emissions in the US. And that amounts to 435,000 disability-adjusted life years. So we can actually quantify the lost life, if you will, due to the pollution that's caused from healthcare. So this is kind of a tragedy. So how exactly are we trying to do this? Well, it's a systems issue, right? It's not simple, as anything in healthcare is. So if you think about all the things that go into healthcare, these all have an impact. I think very much in this physical realm, right? So the lighting, the electricity, the disposable goods, the reusable goods, all these supplies that are needed to actually provide care. But there's so many other layers to this that you have to consider when you're looking at changing, right? It's how we pay for health, or how we are reimbursed for healthcare services. It's the contracts we make with other companies. Local training habits, regulations and policies. There's all these things that are tangled up together that impact how we provide care. So data is really important, and that's where the life cycle assessment comes in.